being here with us again today. Once again, my name is Ochea Patrick Ekre, the convener of Welfare of the African Vulnerable and Egalitarian Foundation. And you'll be wondering why this expository message, why this information? You'll be wondering what do you stand to gain from this information you are releasing? Fine, I will tell you. It's a very simple issue. From the bond, from the passions for human's life, welfare of the African vulnerable has come to stay. From the passion of her towards human life, welfare, we talk about the well-being of people that cannot help themselves, people that need other people to live a normal life. For example, some women, children, disabled individual, socioeconomic handicap, IDPs, prisoners, drug addicts, so on and so forth, victim of rape, abuse, trafficking, and all of that. They are all vulnerable. This group of people cannot help themselves on their own. And they depend on you that have everything that is living above average to help them. But the situation we find ourselves is the other way around. Instead of helping this class of people, we still look for a means to exploit them, a means to use them to make money. Very, very pathetic. This is where it born from. The other side of this name, welfare of the African vulnerable, an egalitarian foundation. Egalitarian is a theory that believes that everybody should live equally. At least if we are not living equally, let the fairness be there. You can imagine, let the fairness be there. You cannot be in the society where some persons are living in oceans of wealth and others are crying to survive with the peanuts. The same community, the same society that somebody is looting billions, others are there dying of a condition that will cost them just 10,000. They are losing their life and beloved one. Others are looking for what the family will eat per meal. There is no equity, there is no fairness, there is no justice. So, these are the definition of what we mean by welfare of the African Vulnerable and Egalitarian Foundation. And our thematic areas will touch the areas of health, very serious, education, and social justice. These are the three cardinal things that formed that part, formed what we call welfare of the African Vulnerable and Egalitarian Foundation. So from that background, the concern is about the welfare of the poor person. The concern of this foundation is about the well-being of that vulnerable person. The concern of this foundation is what can we do to eliminate the suffering of the poor, of the disadvantaged, of the marginalized group. Do you get where we are coming from? So every informations, every secret being released is to their advantage. Because from today you will know that as a vulnerable person, no matter your social status, no matter your financial status, no matter your background, your education background whatsoever, there is one common thing that is there in Nigeria constitutions: your freedom to health. You have a right to health, a good health. And there is a statutory document that back it up. Health Acts. You understand? The National Health Act was passed 31st October 2014. You understand? And it's mandatory, that every professional attend to anybody brought to the hospital, irrespective of their background. There are so many things we are going to look at this point. You understand? The public sector, the private sector, what do we do? You understand? I want to look at it. So we want to kind of create awareness in the mind of our people, in the mind of people we are representing, in the mind of that poor person in the society, in the mind of the person that when you talk about hospital, it not belongs to us. Where can we afford it? That is what we want to do. We want to disabuse their mind that even as at their level they can go to is some certain level of health care they can enjoy in it. Basic, universal basic health coverage is there. Basic healthcare provision fund is there. All these things are there and they are conceived from us, the public, those that are supposed to enjoy it. And that is the essence of bringing this to you. So all these statements now is just to introduce what we are expected to have in a short while in my subsequent video. And like I've said from the beginning, all my video is going to go subsequentially. It's going to follow each other. You understand? So you don't have to jump them. Some of this thing is going to be there just advice. Some of them is going to be a real topic. And after I've dealt with the issue of the mismanagement, the kind of malpractice, issue of malhandling of clients in the hospital, or the patients in the hospital, and all of that, and how to redress it, I'm going to tell you about so many health issues. Yes, so many health issues that you may not even imagine what could have been done if you didn't get the information. I'm going to tell you for free. You understand? And my joy is that you live where, you stay where, you stay healthy. That is all I'm asking for, not for your money. Yes, I need money, of course. I need money. Only thing you have to do for me is just to like my page and go on. Go with the information for free. I want to tell you so many things. You understand? I'm going to tell you topic. You understand? I want to tell you so many things that you don't. Nobody will tell you the secret, and you don't know. And I'm going to tell you about the three tiers of health system in Nigeria. 3 tiers and their importance. You understand? Some people, because you have the money, you feel malaria, you jump to the tertiary institution because you know the professor then whatever. They will treat you as a professor. Yes, one, they will give you a big name of that ailment. Yes, the name that one community is supposed to give you small and give you small drug and you will get yourself. The same thing. They will give you a big name and from that big name you pay big money. You get it? So the idea behind establishing 3 tiers of health, you understand, is not for nothing. It's very important. It's a wisdom. It's a wise decision. You understand? And it treats a kind of trained personnel, manpower at all this level. He graduates from one level to another, graduate from one level, but we overlook that basic one, the the root, the grassroots, which is close to you. You want to go to teaching hospital, you want to go to FMC, you want to go to this cottage, you want to go to that, you want to go to specialists and all of that. For malaria, for headache, for abdominal discomfort, for dizziness, common ailment that doesn't have anything. That's a lay person that at least go for training like a well-trained auxiliary can tell you what you can do and you'll be fine. Some of these problems, just to take a good fluid, take a rest and you'll be fine. You are going to teaching hospital, going to cause a kind of inconvenience to other serious conditions. I'm going to tell you for free why you should desist from such character, even if you have all the money in the world. If you have enough money, don't disturb us in Nigeria. Go abroad, go and take your treatments. Anytime anything happens to your family. And this video is not meant for those that are capable, financially buoyant to go abroad. It is for those that are struggling to survive. So please, thank you very much. I will continue the next video and like to see you there. Try and like the page.